Oropouche virus is a zoonotic disease that doctors say is transmitted by tiny flies called midges and mosquitoes. It was originally discovered in Trinidad and Tobago in the 1950s and has mostly been in circulation in Central and South America. But recently, cases have been popping up in new places like Cuba, Italy, and Spain, according to new research. The virus can live in birds and primates and has been known to live in sloths as well. Infectious diseases expert Dr. Isaac Bogosh explains people are most often infected through mosquito bites and then will have symptoms similar to dengue fever, including muscle aches and pains, headache, high fever, and sometimes a rash. 500,000 cases of Oropouche have been recorded since the virus was first discovered, which is a relatively small number for medical research, so knowledge is limited. However, in July, 2 young Brazilian women without any underlying health conditions died from the virus. There are investigations underway into infections during pregnancy and potential birth defects and stillbirths.
The number of reported cases, both in endemic areas and in return travelers, is likely the tip of the iceberg. This is likely going unnoticed, especially in return travelers who are ill. They might have, for example, a dengue test that returns as negative, and people ultimately recover from this illness. You've got to wonder how many cases have been imported to Canada and other parts of the world that have gone unnoticed.
Dr. Bogosh says there is no vaccine or treatment for Oropouche virus. One of the best ways for people to protect themselves is to wear bug repellent when traveling abroad and to self-monitor for symptoms when coming home. Catherine Ward, Global News, Toronto.
After 9 days in the hospital and 11 in rehab, 88-year-old Sue Fleming is now suing Boar's Head for the listeria infection that she claims came from eating liverwurst.
To be honest, I went through hell and back again, and I'm coming out of it. I don't wish it on anyone. I'm very blessed that I'm alive and talking to you right now.
The CDC reports 3 people have died from eating contaminated deli meats in Virginia, Illinois, and New Jersey. Boar's Head now recalling 71 prepackaged and ready-to-eat meat and poultry products tied to a Virginia plant with sell-by dates through October 17th, including liverwurst, ham, bologna, beef salami, and bacon.
It's literally the only brand I buy.
The CDC reports 43 hospitalizations across 13 states now tied to the outbreak, though the real number of people who become sick could be much higher. Listeria is the 3rd leading cause of death from foodborne illness, with pregnant women, newborns, senior citizens, and anyone with a weakened immune system at greatest risk.
Flu-like symptoms, fever, muscle aches, GI upset, those are the classic symptoms of listeria. And usually people know that something's wrong because they aren't really able to tolerate any fluids.
Boar's Head says food safety is our top priority, and we express our deepest sympathies for the affected families. The company and CDC recommend throwing out any affected deli meat, clean any surface that came in contact with the meat, including refrigerators and countertops.
We have a consumer alert this morning. The Centers for Disease Control and Prevention says a recent salmonella outbreak is linked to cucumbers. The cucumbers sickened 449 people across 31 states and D.C. Most of the illnesses in our region are in Pennsylvania. Many of the reports of sickness date back to early March, and the CDC says the cucumbers are no longer on the shelves. They were from 2 Florida companies.
Atlanta-based CDC is warning about a rise in a seasonal respiratory virus, and it appears to be making a resurgence after the COVID-19 pandemic. Parvovirus is common. About half of the population has detectable antibodies by the time they reach 20 years old. But here's the problem. Infections dropped with the precautions taken during the COVID-19 pandemic. That led to a reduction in immunity. CDC test shows the rate of parvo in kids ages 5 to 9 rose from about 15% to 40%. Doctors are now issuing a warning primarily for pregnant women.
Right now at 5:30, new data from the state shows over a quarter of North Carolina counties have now reported cases of a food-related parasite. Thanks for joining us tonight. I'm Lena Tillett.
And I'm Dan Haggerty. Wake County still has the most cases, 125. This comes as the hunt to find the source of this outbreak continues.
WRAL health reporter Grace Haba continues to investigate this puzzling case. Grace has been all over this, joining us now live with updates. Grace.
Yeah, we've continued to dig into this story to try to bring our viewers more answers about what's making people so sick here in North Carolina. And we now know today cyclospora cases this year have impacted people well beyond just Wake County, extending to other parts of North Carolina. 28 counties have reported at least one case of cyclospora so far this year, according to DHHS. Wake leads the way with 125 cases, followed by New Hanover with 17, Brunswick and Mecklenburg with 14, and Guilford County with 13.
The local health department staff try and interview every one of those cases to determine what is their food history, what might be their likely source of exposure.
With at least 206 cases across multiple counties, we asked the state what clues that kind of geographical spread could give.
Does that seem to suggest that this is coming from more than one source?
Well, that's a great question. It could be coming from more than one source, or it could be one source that's very widely distributed.
Dr. Carl Williams with DHHS's Communicable Disease Branch says further analyzing stool samples from patients could also reveal additional leads.
If it's a single point source that's distributed widely, you're more likely to see highly related specimens from the patients. If it's multiple introductions of cyclospora from different sources, you're going to see different genetic sequences.
The downside, he says, that kind of diagnostic testing isn't currently required in North Carolina, and most specimens simply aren't kept long enough by labs for it to be considered. Now, you may remember a couple days ago I told you about using grocery store membership cards and credit card receipts to track what people bought and ate. Well, the state says those are also additional tools that they are using to try and sort all of this out.
HIV/AIDS Awareness Day is tomorrow.
South Carolina's Department of Public Health says almost 15,000 people, including about 200 kids and teens, are living with HIV infection or AIDS here in South Carolina.
Our Caroline Spikes joins us live from Palmetto Community Care, which is offering some free HIV testing.
And Caroline, why did they say this is so important to acknowledge?
Well, Michael and Justin, the director of marketing and development, Richard Reams here, says it's important for them to try to break down barriers and any stigmas that may come with HIV testing.
People might not even be aware that the CDC recommends that every person receives at least one HIV test in their lifetime.
South Carolina is ranked in the top 10 states and territories in the U.S. for HIV positive cases per 100,000 people. Reams says that's why it's important to them and their organization to build a safe, accessible environment in the Low Country.
I think the more concerning part is that the South continues to rank so high in the per capita diagnosis. It's not necessarily that there are more, it's just that we're not making the dent that we should.
The Campaign for Southern Equality's director of Gender Justice, Ivy Hill, says breaking down a stigma is one of their top priorities.
I think there's a lot of that old rhetoric sort of left over that to be HIV positive is like a death sentence, and that's just really not the case.
They say as someone who is not only an advocate, but a member of the LGBTQ+ community as well, that medication and treatment have come a long way, offering more options if someone does test HIV positive.
It's not a scary thing. It's quick, it's easy. And if you do get a positive, like I said, medicine has come so far.
They add that if you do get a positive result, at least you know in order to combat the diagnosis so you can live a happy, healthy life. Palmetto Community Care not only offers free testing, but also offers additional medical care.
There are a whole plethora of options, but it starts with knowing your status, because you can't know what you need until you know where you are.
Now, if you or a loved one are interested in getting tested here tomorrow, they're offering it from 7:30 a.m. to 3:30 p.m. They also say that if you do come tomorrow, there will be an opportunity, or they will be offering a free gift card. Reporting in North Charleston, Caroline Spikes, Live 5 News.
Several towns in Massachusetts are now critical risk zones for a serious mosquito-borne illness.
I don't know if I wouldn't go out. I'd probably just wear long pants and long sleeves.
Communities across the U.S. state are trying to prevent the spread of Eastern equine encephalitis after a rare case was reported in a man in his 80s.
Headache, a fever, but because of the inflammation of the brain, you can have a decreased level of consciousness and seizures.
Infectious disease specialists say it can be dangerous and deadly.
It's a pretty catastrophic infection. It can cause a very, very severe syndrome of encephalitis, which means inflammation of the brain, and it carries a rather high mortality rate.
Officials in Massachusetts are spraying widely, some towns closing parks and fields and urging residents to avoid outdoor activities during peak mosquito hours from dusk until dawn.
Please don't do this to our kids.
800 people signed a petition. Health Canada says the last reported human case of the disease in this country was in 2016. But health officials in the city of Ottawa say a horse there recently tested positive. So they're encouraging residents to use insect repellent, wear light-colored long pants and long sleeves, make sure windows and doors have screens, and remove or empty standing water sites around your home. The virus has no cure or vaccine for humans, but Canadians shouldn't panic, says this expert.
Outbreaks of this particular disease in the United States and in New England seem to be only very small handfuls of cases.
Canada's public health agency monitors mosquito-borne diseases, but it says unlike West Nile virus, human cases of Eastern equine encephalitis don't have to be reported to the agency, and there's no formal surveillance system in place. Alison Northcott, CBC News, Montreal.